Welcome back to Casey Cares, Kansas City's nonprofit voice, produced by Charitable Communications, telling the stories of Kansas City nonprofits. We are proudly sponsored by the Ewing Marion Kaufman Foundation. I am Bobby Keys. I think we got Ruth in there.
And I am Ruth Baum. I am Ruth Baum Biggest, and I am here, and we are in the safety of our home, complying with all the rules and guidelines for COVID-19, but we refuse to let that get in the way of sharing great stories of nonprofits and folks working in the nonprofit sector. And what better person to help us cope with this crazy time than Barb Unell, who joins us today with Raised with Love and Limits Foundation. Barb, I'm so glad to finally get you on the show. It took a pandemic to get you to sit still long enough where we could have a conversation.
Oh, so, don't say that. Don't say that.
No, you're so busy, but you're so busy. And we want to hear more about Raised with Love and Limits, your foundation, and what you're doing. Enlighten us, please.
Oh, thank you. Well, what I'm doing is really so excited about bringing families and educators and anybody really who touches the life of a child a tool that they can use that will help them teach with a healthy mindset. And that is self-talk, empathy, and teaching, that SET. They can help teach children, particularly in this time when we're all together in the same room. This tool that we developed, our nonprofit Raised with Love and Limits Foundation developed, is called Behavior Checker. And the backstory of developing Behavior Checker, and someone can actually go to behaviorchecker.org to check it out. The most exciting piece about Behavior Checker is that we are trying to get on the front side of some of these behaviors that kids do that can escalate and that can lead to really difficult challenges in health, learning, and behavior. So, for example, we're all talking about, I think it's so apropos, we're all so hoping and waiting and counting on a vaccine, if you will, a medicine, or I use vaccine in the broadest terms, to help us prevent this terrible virus that is ravaging through our world. And the importance of looking at how important it is to prevent cannot be more in focus, right, Ruth, right now? The idea of taking care of ourselves. And we have that same kind of intense focus with our Raised with Love and Limits Foundation around preventing behaviors from escalating, helping to teach ourselves how to self-calm, how to use empathy, and how to teach children positive behaviors. So if there ever was a time where thousands of times a day we have the opportunity to be with our children and teach them positive behaviors, to teach them how to self-calm, to teach them how to be empathic to each other, it is now. And every time I hear developing a vaccine for this terrible virus, I always think about, gosh, what if we had a prescription to help us reduce mental and physical health problems? Well, the science shows us that actually the caring, supportive, protective adult in a child's life is that very prescription that has been demonstrated to help prevent those problems. It's interesting science that we talk about in our book, the Raised with Love and Limits Foundation, and it's in our website, behaviorchecker.org. And I could spend the next, 40, 50, 60 hours. No, wait, we only have 20 minutes, right? Talking with you about it as well. But I'd like to use some of this time today just to talk about how incredibly important it is that the science shows us, even more than and I've been doing this work in parenting and parenting education for 40 years, but never has there been a more intense focus in terms of research and science on the amazing impact that at least one committed relationship with a supportive parent or another caregiver has. It's the single most common factor for children who develop resilience and what's called executive functioning, that's problem solving and coping. So that's from the Center on the Developing Child from Harvard University. The National Academies of Science says the same thing. Their single most important factor influencing a child's healthy development is safe, stable, and nurturing relationships with a mother, father, or other primary caregiver. So this work in our foundation, the Raised with Love and Limits Foundation, focuses on that very factor, on systemically changing the awareness that we have on that primary relationship between a child and adult that we might not have before really focused on in terms of prevention of things like the major illnesses, heart disease and diabetes and obesity and depression and abuse and drug addiction. The data is right there that shows that kind of relationship can actually help to develop the resilience and prevention of these problems. But the problem has been, so where do you get this information on how do you be a caring, supportive, protective adult, right? What does that really mean at the end of the day? And that's why we developed a behavior checker and these prescriptions, if you will, for over 150 common childhood behaviors to help parents know how to respond to those behaviors in the ways that build this positive relationship.
What's been some of the most surprising research that you've uncovered as you put Behavior Checker together?
I think the research on the importance of these caring relationships and the idea of bonding and nurturing has always been there. About what there are several movements you probably heard of in various nonprofits actually that work all over the country that help deal with what's called toxic stress or trauma. We use the word trauma when we talk about it with children. So children who have been through trauma, and we all know, again, speaking to the moment, on how much anxiety and worry and concern and a sense of the unknown, the upheaval that is happening now. So for many families, as we know, that happens every day of their lives, and without this crisis. So there are so many wonderful, incredible nonprofits throughout the country, as well as in Kansas City, that work in that area of helping to heal, build resilience, and address the impact of toxic stress. What we're seeing now in terms of parenting is with time. The science is the brain science is tying parenting. Literally, this sounds so simple, right? This interactions with our children that we have every day, literally, in raising them, but tying those simple interactions to prevention of heart disease. Wait a minute. So if I help teach my child, how to be patient and cope with, let's say, I don't know, give me a behavior, cope with when someone puts them down, let's say, all right, and to cope with that in a way that is positive and builds a sense of respect and self-respect. That's going to prevent heart disease? The answer to that is what? Give it to me. Give it to me with a what? Yes. 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 I call it gift with purchase. When you buy something and then you get the little travel bag, right? Well, right. This is what the science is telling us. It's like not only are you going to help teach these behaviors, but you're also going to help prevent, as I said, the 5 major causes of death in this country, as well as all of the other issues that so many nonprofits and so many organizations spend their whole lives and all the resources addressing. So we need to take care, obviously, of families that have been through trauma and toxic stress, and people who are in the moment experiencing that, no doubt. But what about at the same time helping to work on the front end to help prevent that toxic stress and that trauma adverse experiences, And so we are working, our nonprofit is working with hospitals, children's hospitals, pediatricians, social service agencies, foster agencies, foster child agencies, all kinds of organizations to help them have Behavior Checker as one of their tools in their toolkit, and then be able to work with families so that they can have this tool when they leave the office or leave the appointment or they leave the space where they're getting that help. How do they continue to be supported in the hardest job, really, and the lifelong job of being a parent? It is a job that is 24/7, 365. And so why shouldn't there be a tool? That's what our foundation asked about 10 years ago or so, and through the generosity of this community, developed this tool and began the nonprofit. And through, as you know, working with so many nonprofits, so much support to develop this tool that is practical and available and accessible. It doesn't exist anywhere else. That's what's so fascinating to me, Ruth, is surely there was another Behavior Checker, right? Surely there was something else like this out there. And we're working with hospitals across the country, Children's Minnesota, which is the 7th largest children's hospital in the country, the 2 children's hospitals and 12 clinics. They're working with Behavior Checker, other hospitals and other pediatric clinics across the country. There really isn't another tool like this. So we're proud that Kansas City has supported this and that the researchers and pediatricians and social workers have to work with us, nurses, all those on the front lines you're hearing about right now. Many of those same kinds of individuals helped develop this behavioral tool.
Why did you decide to go the foundation nonprofit route with this?
Well, you mean with the tool?
Yes.
Yes. Well, good question. The issue of helping us raise our families, and the question you asked before about what's the science or what's the research. So again, we a lot of us have thought about parenting as just just something we do. I mean, obviously, parenting has been around a long time, right? Since the beginning of time, would you say? There's no shortage of parenting information out there. There's no shortage of blogs, particularly now. So you say, well, there's all this parenting information. Why don't the world need another tool or even another nonprofit? But what we don't see and what we haven't done is be able to translate that science into something that actually elevates the importance of this relationship building that we all have, which is really what parenting is, right? I mean, at the end of the day, or the beginning of the day, and to be able to elevate that, to actually prioritize that in the way that we might prioritize anything else in our life. I always say it's like there should be, the fact that we don't question whether we should drink water. Water. We all need water to live. Well, we all need caring, supportive, protective relationships to live. So the mission of this became the priority. And so just like you do have a mission to stop some sort of, prevent some sort of disease. Again, I keep talking about that because, of course, we're all talking about this now. But the preponderance of all of these things that I talked about, the drug addiction and obesity and heart disease and suicide, all of violence, sexual violence, all of these behaviors, the research is now showing stunning connection to early childhood experiences, and relationships with parents are the one factor that the data shows can actually help to build resilience and reduce the toxic stress from these experiences. So knowing that, we had no other choice, right? I mean, now that you hear that, you hear it too. You're, I'm sure, thinking, Ruth, like, wow, I need to be part of that, or I need to show that to my kids, or I need to show that to my neighbors. I mean, it's not about us as the developers of the nonprofit. It's about all of us working together to get on the front end of this so that we can have a healthier, it's really a public health initiative rather than a parenting initiative, but has to do with these relationships. So it's really about public health. And as I said, it resonates so wildly because you can't get on the news program right now or anything without people talking about how overwhelmed parents are and how stressful it is, right? You know, when kids are at home and kids are doing schooling and kids are, at some home and people are working from home or some have lost their jobs, as we know. So a lot of the conversation is around what do we do with the kids? How do we deal with the kids? Right? Mm-hmm. Some folks are telling us, and when I'm doing my parent coaching, they're saying, you know, I haven't spent so much time with my kids in their whole life. Right. You know, and they don't really know their kids. So we're working with them to try to turn that into a positive versus trying to, look at it as a negative. And so clearly this is not a positive situation, we all know, but how do we create those positive relationships in this time that we have together? And we have the tools to do that.
Well, it's Raised with Love and Limits Foundation and your key invention, behaviorchecker.org. I would encourage parents of any age of children. Mine are grown, but I'm scrolling through some of these now, and even though they may be at a distance, there are very helpful things for all of us to glean. There's a lot of self-talk and sympathy and yourself up. So Barb, this is just wonderful. And thank you and Bob and everybody that has partnered with you. And I encourage people to go out and learn more about this great resource.
Thank you. Appreciate it so much. I'm thrilled to be with you.
COVID-19 is a severe lung infection. Trust the American Lung Association for science-based public health information, especially for the 36 million Americans who live with lung disease. We have resources to protect your lung health. Access expertise from medical professionals and peer-to-peer support through our online communities. Visit lung.org for daily updates or call 1-800-LUNG-USA.
Inspired by Ewan Mary and Kaufman, the Kaufman Foundation believes that every person, regardless of their background, should have the opportunity to learn, to take risks, and to own their success. Working together with our Kansas City community and beyond, we take on approaches that break down barriers, providing people with the necessary skills throughout life to make or take a job and ultimately give back to their community. By listening to the communities we serve, tap into our learnings and relationships, and bring everyone together to build and support programs that improve education, boost entrepreneurship, and help Kansas City thrive. Learn more at Kaufman.org.